Thank you very much at magandang araw mga kaibigan. Nagbabalik po ang inyong programa Aksyon Central Luzon Special Edition. Ito po si Sunny Lopez again, and of course, alam niyo na ho, part ho ng ating programa ito tungkol sa pangkalusugan. And this time we talk about tungkol po sa dermatology, skincare, pampaganda, pampagwapo, pampamaintain, ganyan, no? Siguro ho, very interesting topic ito. At siyempre ho, ang lagi natin nakakasama dito ay walang ibang ating co-host, si Dr. Rowie Medina. Ma'am, welcome again to the show.
Hello, Sunny. Hello, Central Luzon. Add ko lang dun sa sinabi mong pampaganda. Meron din siyang pampabata.
Pampabata.
So parang ang title natin, Be Forever Young.
Yes.
So we have a guest, very special guest, Dr. Menchu Liwanag, a dermatologist. So, Doctora, welcome to Action Central Luzon Special Edition.
Thank you very much for inviting me here.
It's about time.
I'm really very grateful. Thank you.
Itong larangan nyo, kumbaga, if we talk about it, this is something that everybody wants to talk about now. Because sabi nila, if you have a little money and you wanna stay young, yung maganda palagi, kailangan punta ka sa dermatologist.
Mag-i-invest ka.
Mag-i-invest ka. Oh,
It's an investment.
Actually, yes, but as you've said kanina nga, it's not only about from the doctor, yung mga technologies natin, you should always feel and look young, deep within, and not only inside but outside.
It will follow, you know.
Yeah,
if you feel good.
Or sometimes you gotta look good to feel good, di ba? What comes first?
Yeah, it's not only through lasers and everything. Exercise, diet, stress-free.
Pero parang nahirap yata
Mahirap
gawin nun. So, ano yung pwede munang gawin? Ano muna yung pwedeng gawin? So,
emergency.
So, let's start, Doktora. Siguro, so we start young.
Yes.
Start young. So, sa mga, kasi, more of preventive, as what you have said. Sunny is always, Sunny and I will always say that it's always about prevention. So, before sila magkaroon ng problema, dapat they should start young and early, so to prevent it. So, can you start with acne with kids? Kasi yun yung unang skin yung mga teens na nagkakaroon ng pimples Doon muna, paano ba nila aalagaan? Ano bang gagawin nila para hanggang tumanda sila, maging makinis yung kutis nila?
Actually, ang importante, you should know what causes acne. No? So acne, in layman's term, pimples or tagyawat, no, whether the basic lesions of acne are the comedones, blackheads or whiteheads, tapos nagiging mga yung may nana, pustules, papules, yung mga cysts, yung mga bukol-bukol na. So, early treatment, actually, it can start as early as 10, peak age is 15 to 18. The cause of acne is unknown, but there are lots of factors to consider. One, of course, hereditary predisposition. Meron talagang may lahing tagyawat.
Kasalanan ng nanay at tatay.
Okay. And then, also, among teenagers, it's really hormonal. Kahit wala silang lahi, because of their age, pag nagdadalaga, nagbibinata, the hormones are active. And these hormones, they stimulate the oil glands to produce more oil, mabilis mag-attract ng bacteria, acne formation. But the myth, like food, chocolates or nuts, there's no scientific basis actually.
How about staying up so late? Internet, non-stop social networking.
Sabi ko nga sa mga teenagers ko, if you can avoid yung staying late or sleepless nights, okay lang. If they really want to be dean's listers or scholars, okay lang yan. They really have to study. Pero yung mga extra, if they can avoid that, better. Yun. And then early treatment. Proper care, the right, aside from the food, of course, if they ask me about food for acne, complete balanced diet, not really chocolate-free or mga oily foods, not really that. And then yung kapag talaga medyo nag-uumpisa na, yung tamang soap is really very important.
Basic maintenance.
Basic maintenance, you have to clean your face well. Actually, it's not only the face. You can have it on any part of the skin rich in oil glands.
They have pimples on the back nila, sa neck.
Kasi yung acne, ang location is on the oily areas of our skin. So face, occasionally on ears, neck, chest, back, and upper arms. So swerte talaga yung magandang lahi. Kagaya mo, ganda balat.
Gaya ni Doktora. Si Sunny walang pimples. So walang sign na nag-pimples ng bata siya.
Marami naman moles.
So parang kasi maraming gamot na nilalagay. We have over-the-counter drugs.
Yes.
Pero ano ba yung pinaka-basic na pwede nilang ilagay, ipahid sa mga face nila?
Relative to that, do you advise them to go over the counter? So
No, I don't advise. Kasi as of this time, no, even yung mga ibang hindi naman totoong pharmacists, they advise pa nga, bleaching soaps. Ang daming problema ng mga likas yung mga ganyan, papaya
Kasi left
soaps,
and right ang
koji.
mga soap na
Grabe.
available.
So,
yung kinakaskas, di ba? Dati nung naunang panahon, maraming
Mena,
kinakaskas.
lime.
Oh, yan, mga yan.
tawag ko sa menang soup.
Bakit?
Kasi
Anong effect?
yung initially parang mapula sila.
So, kala
Yes.
nila maganda na kutis nila kasi
And then,
mapula.
actually, yung light lang dito sa studio, it can cause you pigmentations. Basta any light, kahit cooking siya or something, very sensitive. Kala mo yung pula, maganda din, para na silang lechon.
Yes,
And
yes.
then, nagkakaroon ng photosensitivity reaction, mangingitim. Ayun na yung cause ng melasma, which is really difficult to treat. Yun. Pero sa ano naman, going back to these adolescent
Yes, stages. Problems.
patients, yung problems nila for acne, meron talagang soaps, yung mga pH na soaps na that will match our skin. No? Siyempre, from the doctor, kahit na kung hindi pa malala, you can consult kahit walang treatment, hindi na kailangan. Mere application of the proper medicines. Uso na kasi ngayon, yung mga dual preparations
Yes.
like benzoyl peroxide and clindamycin in the form of one gel. Kasi yung iba tamad. So sa mga simple lang na acne, soap lang, the right soap, merong mga acne soaps na ganyan na recommended by dermatologists. Meron ding mura, may mahal, depende sa ano mo, kaya mo.
Sa budget.
Sa budget mo, meron. Hindi lahat kasi ng mahal, maganda.
Pero when do you go and see a doctor? If you tried all these things that you are mentioning right now, mga soap na ganyan, mga
Pag
basic.
hindi na siya tumatalab, of course. So despite the use of this one, yung proper care mo, hindi pa rin tumatalab.
Ginawa mo na lahat.
That's the time you have to go.
So they shouldn't wait na magbutas-butas yung
Hindi,
mukha.
of course. Kasi it's too, although we have now a new laser at AUF, is for the acne scars, mahal din. So at saka it's
Mas
really
mura na
different.
i-maintain nila kaysa
Yes.
i-treat nila.
Yes, meron namang mura, may mahal eh.
And it's nice even at a young age to invest sa yung skin. Maraming yung mayaman ngayon dahil maganda yung ano, di ba?
Pero kasi yung mga bata, parang it's hard enough for them to be in school. Tapos ito pa, meron kang teenage crisis, biglang ang iyong puberty, di ba? Nag-change na yung voice mo, nagkaka-pimples ka pa. Tapos yung mga babae, they have this monthly period. So parang naguguluhan na sila talaga. So it's good enough. Doon nagsa-start yung self-confidence nila.
Yes.
So if they look
Or losing
good, yes, gaining it or losing it. So kailangan, they should start really young na mini-maintain yung skin nila.
Pero meron kasing mga kawawa rin na even if they tried a lot of medicines, they don't work. At saka merong mga cystic lesions. Yung talagang, even at an early age, you have to be aggressive. Kasi lang yung mga bukol-bukol na
Oo nga, minsan kasi it's the
parang
food
pigsa.
they eat ba? Then,
Not really.
or,
Not really the
or
food.
Nasa ano sa
exposure,
kanila.
minsan nag-allergies sila.
Hindi. Ako sa
But that's
akin,
a
it's
perception.
hereditary.
In our
Lahi
culture, di ba?
talaga nila yon.
Lahi.
O lahi. But it can be prevented. There are a lot of
So,
medicines.
should they go to regular facial
No,
treatments?
I don't. Of course, it's not because I'm promoting dermatology, no.
Oo.
But para lang you get your money's worth, you go to the right certified dermatologist. Marami
Yes.
kasing pseudo ngayon, pseudo
Yes,
dermatologist.
that's a problem now,
So tingnan lang po yung pangalan ng doktor and kapag nakalagay whether fellow, diplomate, associate, basta merong PDS, Philippine Dermatological Society, you're on the right track. Pero walang PDS, kahit American Academy of Dermatology kasi may mga nakakalusot, o yun, hindi siya totoong derma.
Okay.
So, after nung show, so ano pa yung pwede pa bang makita sa mga teenagers aside from the pimples? Common na nakikita mo sa mga teenagers?
Well, yun yung actually ang pinaka-common talaga, acne, but eczema.
Dry skin.
Eczema talagang dry skin. Ang importante lang naman sa dry skin, emollients. But not all emollients are suitable for your skin kasi merong mga lotions na hindi naman hiyang, for hiyang din. So, of
Pero
course,
is it
yung
okay
mga
to take
dermatologist
lotion?
tested or hypoallergenic lotions to relieve the dry skin. Kasi kapag nag-dry na yung balat niyan, parang halaman. Pag hindi nadidiligan, matutuyo, mamamatay. Ganyan din ang skin natin. Have to
So
moisturize.
especially we have a very, we are in a tropical country,
Yes.
no? So we should wear sunscreen. Kaso akala nila,
Definitely. Oo.
mga sa States lang or sa ibang bansa lang yung nagsa-sunscreen. But they should know that
Hindi kaartihan yan.
hindi siya kaartihan.
Oo,
Kailangan
yan.
nagsa-sunscreen eh. Kasi ano bang protection mo when you're using a sunscreen? Ano yung pwede niyang i-prevent?
Of course, pigmentations, pero yung iba kasi may acne. So they want to have this, get rid of the post-inflammatory hyperpigmentation, yung mga na-heal na siya pero maitim pa rin. So you have to wear sunblock. Actually, akala nila yung sunblock sa matanda lang. Anyone can wear sunblock, lalo na yung mga merong mga atopic dermatitis, yung asthma of the skin, like my kids, no? Yung 18-year-old ko, talagang palagi siyang may singaw na puti-puti, pityriasis alba, because she's athletic. So I always advise her to wear sunscreen. And when you use the sunscreen, it should be at least SPF 30 and above. And it should be 1/4 teaspoon. Hindi yung enough lang na manipis, tapos na. Yun.
So how young pwede mag-sunscreen?
As early as, actually any age, kahit yung mga kids, if they, yung mga atopics na mga batang may eczema, tapos nagsiswimming, they have to wear sunblock.
Right.
Pero merong right sunblock for the sensitive
Kids.
skin, for the kids. So mga adolescents, hindi siya namimili actually ng age. Pero kung gusto mong i-prevent at title nga natin Forever Young,
Yes.
you really have to wear sunblock.
Okay. So but let me ask, no? Can you just Google this or go to the internet and look for the solution to your skin problem? If you're, alam mo naman yung bata ngayon, di ba? Nandiyan sila palagi sa ano. Okay lang yun. Parang nag-over the counter, nag-research sila para sa problema nila. Do you advise them to do that?
Of course, iba pa rin yung advice ng dermatologist. Kaya lang meron kasi rin ng mga sunblocks na hindi mo rin hiyang. No? So meron tayong mga hypoallergenic
And
sunblocks.
siguro what they will see on the internet are just basics. Like they would tell you na to hydrate yourself,
Right.
use sunblock, eat a proper kind of diet. Pero the medical treatment talaga, they have to go to your doctor. You have to consult your doctor. And sabi ko nga, even if maraming nag-mushroom na iba't ibang mga skin clinics, magkakaproblema ka din. So, hahanapin mo din talaga yung doktor na,
Yung so-called
mga doctors
so-called
talaga.
skin
So,
clinic.
unfortunately, umaabot sa ganon. So, to prevent that,
Yes.
you might as well go to your doctor. Not necessarily naman na mahal na may treatment ka agad. Kasi naman, doktor, akala nila, pag pumunta ka sa derma, mahal na kaagad yung mga treatments.
Yes.
Minsan, consultation lang naman, di ba? Not really to go through the treatments.
Pero sa race, ma'am, meron bang ano yan? Meron bang connection sa race din yan? Yung problema sa skin, ganyan?
Yes.
Oo.
Kasi like ng mga blacks,
Oo.
if you're doing lasers, ibang parameters na gagamitin mo sa mga blacks kasi they burn easily, mga blacks, compared sa mga Asians and Caucasians. Actually nga, maganda yung ating skin kasi nasa middle lang tayo. Pag sobrang puti naman, although may advantage din kapag Caucasian ka, no? If you have white skin, like for example, if you're doing some ablative procedures for acne scars, mga ganyan, kaya mabilis silang pumuti, hindi magpeklat, compared sa atin. So
Pero they
there
age easily daw. Yung Caucasians, they age...
Oo.
mas
Kasi
mabilis.
they have very dry skin Very dry skin. Tsaka yung
Ang
kanilang
weather
lifestyle.
din nila din, iba doon naman. Kasi masyadong humid. So,
Tsaka yung mga Europeans,
Right.
mabilis silang mag-wrinkles. Siguro because, I don't know, they drink a lot of wine. Kasi yung wine nila yata, parang yun ang kanilang staple drink.
tsaka ang weather talaga siguro. And it's hereditary. It's in the genes
It's in
na
the genes.
ang kanilang wrinkles. Yung ka-age mo sa ibang country, makikita mo parang 10 years ang difference niya sa Pilipino, di ba? So so ang first yung mga nagpapaputi to look yung mga glutathione injection.
Oh,
Ang dami din kasi left and
Yes.
right eh. So what can you say about it, Doktora?
Actually, there was one time we had a write-up about glutathione, orals, and injectables. So, wala daw danger. But lately,
Yes.
because of several studies,
right.
according to PDS, Philippine Dermatological Society, we don't advise IV injection because it's toxic to the liver. But the orals, okay lang. No?
There's no overdose.
There's no overdose. Pero, syempre, it's expensive too. Like in my case, I have seborrheic dermatitis just like you. Luckily, it's hidden. It's on my neck and body. So I cannot use this. I have a lot of whitening preparations in the clinics, but I cannot use them because I itch readily. That's why, as my vitamins, because glutathione is not only as a whitening pill, it's an antioxidant.
Actually, the whitening is the side effect.
The side effect.
It's the side effect.
It's a protein, but it's an antioxidant. So you can take it as an anti-aging.
Okay.
Yeah. Yung lang ano ko.
So it's
But
okay
others
to take
kasi,
it. But
they
not
sell
the
it left
IV.
and right.
Kasi even if you can afford the IV dahil may pera ka, hindi naman porke linggo-linggo nagpapa-inject ka ng
Saka pupunta lang sa beautician, doon mo gaano.
Oo,
Basta marunong mag-insert ng IV, ginagawa na nila. So, better to take the oral.
Yeah.
Yung collagen naman, maraming
As of this
lumalabas.
time, we have a lot of lectures about this anti-aging, but I haven't heard of collagen. You're taking collagen to improve our skin or
Yes.
ano.
If there's really an effect.
I haven't encountered any scientific basis yet. Siguro a lot of studies have to
Pero,
be ano muna.
ang dami talaga pinag-uusapan, no? About this now.
Kasi pag magli-lecture kami about, like for example, problematic cases, mga pathologic
Yes.
cases, ang end ng aming lecture, yun na, pampaganda.
Yes.
Hindi na natatakal yung aming ano. Puro
doon
ganyan
matatapos
na.
din.
Tapos free consultation, magpapakonsult ka na.
Okay.
Okay lang naman.
Okay. This is a very interesting subject, as we said, but we're going to have a short break, ladies and gentlemen, and we'll pursue this discussion with our special guest and our co-host after these messages.